Welcome to the 2025 Maria and Sam Miller Nursing Excellence Award Ceremony.
Good evening and welcome to the 2025 Nursing Excellence Awards. Tonight's program is about recognizing exemplary caregivers across Cleveland Clinic. Every day, our nursing team commits to the highest standards in healthcare. The awards presented here represent your most noteworthy achievements. Each recipient is remarkable. You lead with skill, you care with kindness, and you make sure patients feel heard and understood. We are proud to celebrate you and thank you for going above and beyond. Cleveland Clinic is a global leader in nursing excellence. Our reputation is built by caregivers who support each other, share knowledge, and deliver outstanding care. We also take a moment to thank Maria Miller and her late husband Sam. Their generosity made this program possible. Their legacy lives on through our nurses and every life that you touch. Congratulations to all of you. You are leading today and shaping tomorrow. Now I'm pleased to introduce Meredith Fox, Senior Vice President and Chief Nursing Officer at Cleveland Clinic.
Thank you, Dr. Mihailovich. Your confidence in our nursing team and your ongoing support of our caregivers encourages an environment where nurses can excel. Cleveland Clinic nurses are among the best in the world. Our pursuit for excellence is rooted in our promise to improve healthcare for all. In every aspect of professional nursing, we aim to set the bar higher, to be the source that others turn to sit at the forefront of healthcare, now and in the future. Our culture is one that empowers nurses to reach their true potential, unveiling both strength and beauty. This evening, we will see and feel the resounding effects that exceptional nursing has on the lives of others. Tonight's honorees provide the safest, highest quality care to patients, families, and communities, showing compassion and empathy with every interaction. To earn this recognition, nurses must be nominated by a fellow caregiver, a patient, or a patient's family member. This year, we received more than 985 nominations. Nearly 200 honorees were recognized across our various health system locations. And tonight marks the culmination of our annual program. In this ceremony, we present our most prestigious enterprise recognitions to 46 recipients. These individuals are the best of the best in Cleveland Clinic's 30,000-member nursing family. As we begin, we take a moment to recognize our program's namesake and express our sincere thanks for their decades of generosity and support. In 2012, Maria Miller and her late husband Sam made it possible for us to continue this program year after year. And we are pleased to share with you a brief glimpse of their genuine respect and appreciation for nurses.
Believe it or not, you mean a lot to me personally. You mean a lot to each other. For you are, as far as I'm concerned, the veritable angels in this community. When a patient comes in, you don't know anything about him or her, and yet you reach out immediately to this individual with the same care, regard, generosity, and empathy we normally reserve for those closest to us. You have helped make the Cleveland Clinic into one of the greatest hospitals and institutions, not in America, not in the Western Hemisphere, but all over the world. Someday, after enough DNA tests, they will discover the gene in the nurse that makes you walking hearts, perennial consciences, and empathetic human beings. And when they do, they will look for this gene in all humanity, and we will have found the answer to peace and no more wars forever.
We begin tonight's awards presentation with the Samuel H. Miller Art of Nursing Award, presented in recognition of the distinguished expertise, talents, and dedication that promote and support caring for patients, families, and fellow caregivers. The 2025 honorees are
Joseph Acord, Cleveland Clinic Main Campus. Joseph joined Internal Medicine Telemetry Unit as a clinical nurse 5 years ago. He is a Magnet Ambassador and a member of the Acute Care Practice Council, Safe Nursing Staffing Committee, and Unit-Based Shared Governance Council. Joseph is the definition of a team player and models the highest standards of the nursing profession.
Shemaine F. Arda, Cleveland Clinic, London. Shemaine's nursing career has spanned the globe, from Dubai to the Philippines. She joined Cleveland Clinic, London nearly 4 years ago as senior staff nurse in the Digestive Disease and Surgery Institute, where she serves as a preceptor and assessor for student nurses. Shemaine is committed to making a positive impact on patients and caregiver colleagues every day.
Nikki Dunkerton, Cleveland Clinic Main Campus. Nikki joined the emergency department after graduating from nursing school more than a decade ago. She has spearheaded several initiatives to enhance the work environment and helped establish the acute care team nurse role. Nikki exemplifies the core values of nursing: compassion, leadership, and continuous improvement in patient care.
Sheila Fansler, Cleveland Clinic Staffing Resources. Sheila has been a nurse for nearly 30 years and considers it a privilege to care for patients. In 2021, she joined the regional float pool for medical, surgical, and step-down units throughout Cleveland Clinic's 10 Northeast Ohio hospitals. Being a float nurse requires flexibility and adaptability, and she excels at both by taking on challenging assignments with grace.
Diana Forst, Cleveland Clinic Staffing Resources. Diana has been a clinical nurse in the float pool at Martin North Hospital since 1998. She is committed to providing world-class patient care and shaping the future of nursing by serving as a Florida delegate on 2 committees within the National Council of State Boards of Nursing. Diana says nursing is more than a job. It is a crusade against mankind's most dangerous diseases.
Manuel Gomez, Cleveland Clinic Main Campus. Manuel is a clinical nurse on the colorectal surgery unit. Committed to team development, he has referred classmates to join his unit and has participated in recruitment events. Manuel precepts caregivers and serves in the Surgical Emergency Response Team RN role. Witnessing the resilience of colorectal patients every day reminds him of why he became a nurse.
Karen T. Hibbard, Cleveland Clinic Akron General. Karen is one of 5 nurses in her family, including her mother, who inspired her to join the profession. She has worked in the cardiovascular ICU for more than 30 years and holds numerous certifications related to critical care. Karen is an invaluable source of knowledge and support for patients and families.
Sharon Hubbard, Cleveland Clinic Indian River Hospital. Sharon has worked at Indian River Hospital for 9 years, the last 4 as an assistant nurse manager in the oncology and orthopedic units. She created a respite room for caregivers to promote well-being and helped develop a bedside shift report initiative. Her dedication to patients and caregivers exemplifies the art of nursing.
Jalen Hewling, Cleveland Clinic Euclid Hospital. Jalen has been at Cleveland Clinic since beginning her nursing career 16 years ago. She recently became assistant nurse manager for surgical services at Euclid Hospital, where she enjoys working with a wide variety of patient populations and cases. She is a problem solver who addresses patient safety concerns, leads monthly huddles with her team, and fosters multidisciplinary collaboration.
Kaylee Hurst, Cleveland Clinic Lutheran Hospital. Kaylee joined the Acute Behavioral Health Unit as a clinical nurse 7 years ago. She is a member of the Patient Advocacy Committee, a nurse mentor, and a Magnet Ambassador. Committed to helping the behavioral health population, Kaylee approaches problems from different perspectives to improve patient care and outcomes.
Patrice Jones Goodwin, Ashtabula Regional Medical Center. After working at Cleveland Clinic Main Campus for more than a decade, Patrice returned to her hometown 8 years ago to become a clinical nurse in a medical surgical unit at Ashtabula Regional Medical Center. She is a strong patient advocate, critical thinker, and team player who guides new nurses. Patrice appreciates making a difference in the lives of patients and their families.
Holly Leonard, Cleveland Clinic Lodi Hospital. Holly has been at Lodi Hospital for most of her 26-year nursing career and currently serves as a charge nurse on the Medical Rehabilitation Unit. She is a member of the Workplace Violence Committee, contributed to the opening of the Lodi Infusion Center, and serves as lead for the hospital's Quality Council. Holly embodies the essence of nursing through her unwavering dedication, exceptional skills, and compassion.
Karen Ann Lachey, Cleveland Clinic Martin North Hospital. Karen has worked in the cardiovascular progressive care unit for her entire 14-year nursing career. She is an exceptional preceptor, dedicated to sharing her wealth of knowledge with new nurses and students. Karen's passion for nursing goes beyond technical skill. She truly loves what she does and approaches every interaction with caring and calming presence.
Leslie Mobley, Cleveland Clinic South Point Hospital. Leslie started at South Point Hospital after graduating from nursing school 28 years ago. She now serves as assistant nurse manager in the intensive care unit, where she mentors new nurses with patience and grace. Leslie brings a deeply personal and human touch to everything she does, reminding all her fellow caregivers why nursing is not just a profession, but a calling.
Darlene Susie Muncie, Cleveland Clinic Weston Hospital. A 36-year nursing veteran, Darlene joined the endoscopy department as a clinical nurse 16 years ago. She is a lead preceptor, magnet champion, and a member of her department's shared governance committee. Darlene strives to deliver exceptional care alongside top-notch physicians and nurses on the advanced endoscopy team.
Edna O. Nahene, Cleveland Clinic Marymount Hospital. Edna has been a clinical nurse on a medical surgical unit for 2 decades. She has contributed to numerous quality and safety projects related to skin care, patient falls, safe handling of hazardous drugs, and more. Edna balances evidence-based practice with compassion to provide world-class patient care.
Tanisha J. Robinson, Cleveland Clinic Mercy Hospital. As assistant nurse manager on a medical surgical unit, Tanisha is a highly skilled clinician and a trusted source of knowledge and guidance for her colleagues. She is an Emerge Stronger peer supporter, chair of the Quality Subcouncil, and a mobility-trained champion. Tanisha is honored to provide comfort and care for patients during vulnerable moments in their lives.
Pratibha Saraswat, Cleveland Clinic Abu Dhabi. Pratibha has been a caregiver at Cleveland Clinic Abu Dhabi since it opened and now serves as charge nurse on a medical surgical unit. She has led the Pain Reassessment Initiative and helped streamline documentation through AI integration. As a member of the Shared Governance Council, Pratibha is committed to advancing patient care through innovation, mentorship, and advocacy.
Julie Seeley, Cleveland Clinic Fairview Hospital. After graduating from nursing school 7 years ago, Julie joined a medical surgical unit. She is chair of the hospital's Nurse Practice Council and a pain mentor, diabetes mentor, stroke champion, and vascular assess resource nurse. Julie is currently pursuing a master's degree to become a clinical nurse specialist.
Brian Taz, Cleveland Clinic Medina Hospital. A nursing veteran of 17 years, Brian works on a medical surgical orthopedic unit. He is a vascular access resource nurse and serves on the hospital's skincare team. Brian enjoys mentoring new nurses, teaching wound care techniques to caregivers, and connecting with patients.
Dina Tidd, Cleveland Clinic Union Hospital. Committed to continuous learning, Dina is proud of her journey from state-tested nursing assistant to an LPN and then a clinical nurse. For the past 9 years, she has worked on the inpatient rehabilitation unit. Dina collaborates with colleagues and embraces technological advancements to improve patient outcomes.
Jessica Uhas, Cleveland Clinic, Avon Hospital. Jessica is a nurse manager of the intensive care unit, where she helped launch the adult medical emergency team. Committed to patient safety, she is a member of the Sepsis Task Force and Code Review Committee. Jessica fosters a relationship-based culture on her unit and always comes to work with a positive attitude and smile.
Congratulations to all of our Samuel H. Miller Art of Nursing Award recipients. Your compassion and empathy are a true testament to putting patients first.
Our professional practice model helps nurses throughout the enterprise understand what we stand for, what's important to us, and where our goals are over time.
It's the roadmap. It's our values in action.
All of these pieces come together and help our nurses be the very best they can be.
This model isn't just a guide to what we do, it's who we are.
Quality and safety is absolutely essential. Not only is it best for our patients, but it really fills our cup as well, to know that we're able to provide this type of care. We like to guide nursing practice, so we write policies, guidelines, in what we know is best. That's one of the things that makes me most proud to be a caregiver here, is that you're supported to make sure our patients remain safe and our fellow caregivers remain safe.
A relationship-based culture guides so much of our work, because at the core of everything we do, we need connections with people. It takes our very clinical and fast-paced environments and makes it more human. It allows us as clinicians to really connect with one another, our patients, and ultimately our community. We have such a unique privilege of opening our hands to people at their most vulnerable times. When we work together, grounded in this culture of compassion for one another and for our patients, it really helps elevate all of our outcomes.
Professional practice is what nurses bring to our practice. Their skills, their talents, their abilities, their expertise. Professional development builds on that, and it starts the very first day that a nurse joins the Cleveland Clinic. There is a path for courses and leadership and opportunities to learn and grow and constantly develop. This helps nurses practice at the top of their license with their expertise and ultimately have the best outcomes for the patient. It is really the epitome of lifelong learning.
We want nurses to participate in research, evidence-based practice, or innovation. Every nurse should be thinking creatively, should be thinking about what are those issues, those problems that they encounter day in and day out, and they should be sharing that with us so that we can help them be part of the solutions. We want to set that tone. We want to be the movers and shakers who figure out that something needs to change, and then we want to share it with the rest of the world so we can help others in the nursing profession do better for our patients.
One of the greatest pieces about the professional practice model here at the Cleveland Clinic is that it is ours. It was developed by our nurses. Everybody comes wanting to do their very best, and this professional practice model supports them in doing that.
It's important for every nurse to raise their voice because that's how we make change happen. That's how we become better.
It's what connects us back to the core of why we went into nursing in the first place.
We are the largest group of caregivers within the organization, which makes us a very strong force and really puts us in such a great position to lead.
There's no greater place to be a nurse.
The Professional Practice Model Award for Quality and Safety is presented in recognition of nurses providing safe care where patients and caregivers achieve high-quality outcomes. The 2025 honorees are
Kayla Little, Cleveland Clinic, Main Campus. Kayla is a clinical nurse specialist who frequently participates in quality improvement initiatives that impact care across Cleveland Clinic. She led the development of process confirmation tools for CAUTI, CLABSI, HAPPY, and FALLS. Kayla also serves as nursing lead for 2 multidisciplinary teams, one that's creating a tool for urine culture collection, and the other for standardizing patient transfers.
Devi Tasic, Cleveland Clinic South Point Hospital. Devi is a clinical nurse in the ICU whose innovative approaches have led to improvements in processes and patient care. As a skin champion, Devi participates in monthly skin rounds and created a skin audit tool for caregivers. She has been instrumental in introducing best practices and advocates for the standardization of practices across the health system.
Thank you, Kayla and Devi, for your unwavering dedication to quality and safety.
The Professional Practice Model Award for Relationship-Based Culture is presented in recognition of significant contributions to build and promote strong relationships with patients, families, fellow caregivers, and the community. The 2025 honorees are
Christina Della Torre, Tiffany Medical Office Building. As the only nurse on staff at the Tiffany Medical Office Building, Christina collaborates with clinicians to deliver evidence-based patient care. She is a preceptor, high reliability coach, and chair of the Pulmonary Shared Governance Council. Christina is honored to be a nurse and positively impact patients' lives.
Angela Wilson, Cleveland Clinic Fairview Hospital. For the past 5 years, Angela has worked as a clinical nurse on the mother-baby unit. Her calming presence and ability to clearly explain postpartum care help patients recover and confidently adjust to their new roles as parents. Angela also serves as a representative on the Fairview Nurse Practice Council and leads her unit's Shared Governance Committee.
Thank you, Christina and Angela, for your commitment to all the patients you serve.
The Professional Practice Model Award for Professional Practice and Development is presented in recognition of embracing lifelong learning and continuous professional growth to advance the professional practice of nursing. The 2025 honorees are
Catherine Stuck-Boyd, Cleveland Clinic Main Campus. Catherine has served as Education Manager and Director of the Nurse Residency Program for 9 years. Under her leadership, more than 1,000 new graduate nurses have completed orientation, and the residency has expanded across the enterprise. Catherine is committed to continuous improvement in professional practice and dedicated to the success of the next generation of nurses.
Maureen Washock, Cleveland Clinic Main Campus. Maureen is a simulation education specialist whose preparation of caregivers has enhanced the delivery of safe, high-quality care across Cleveland Clinic. Using simulation tools, she supports her colleagues in solving real patient problems and identifying opportunities to improve systems and workflows. Maureen has shared her simulation expertise at numerous national and international conferences.
Thank you, Catherine and Maureen, for your dedication to professional development and education.
The Professional Practice Model Award for Research, Evidence-Based Practice and Innovation is presented in recognition of evidence-based clinical practice and management through research and innovation, which transforms healthcare to provide the best outcome for patients. The 2025 honorees are
Anna Cole, Cleveland Clinic Avon Hospital. Anna is a clinical nurse in the Rapid Observation Unit and a member of the Avon Hospital Research Committee. She routinely engages in collaborative research to enhance patient care practices. In 2024, Anna was selected as a member of the NIH Clinical Research Panel for her commitment to advancing patient care within clinical research.
Brian M. O'Moore, Cleveland Clinic Abu Dhabi. Brian is a clinical nursing supervisor. In 2024, he initiated a project to enhance nursing efficiency through the optimization of flowsheet templates in Epic. The solution standardizes entries and minimizes documentation errors. The project has directly impacted patient care by reducing the amount of time clinical nurses must spend documenting and providing them with more time to focus on their patients.
Thank you, Anna and Brian, for leading by example in promoting evidence-based practice and nursing research.
Congratulations to all our 2025 Professional Practice Model Award recipients.
When we think about healthcare and the work that our nurses do, it's hard to imagine a role more closely tied to what the patient experiences. Our nurses see opportunities to make things better every single day. Nate Hurl loved making things better, but he wasn't somebody who felt the need to do it himself. He loved making things better through other people. I don't know of an individual who's been more impactful outside of the Nursing Institute to the way nurses think and practice than Nate. And I can't imagine a better way to honor Nate's memory than to memorialize him in this award. The work that Nate did, either himself or through our continuous improvement team, really empowered nursing to do what they always wanted to do anyway, which is make the care better for patients. And my hope is that others remember that commitment to improvement, and really I would say a commitment to each other in their own work. We really have an opportunity to magnify the impact of the work we can do, the impact of our skills, of our passion for making things better, when we can ignite that same passion and spark in other caregivers. So my hope is that the recipient of the Nathan Hurl Award really sees herself or himself as not just an improver, but really an agent of change to affect spreading this culture and fostering improvement everywhere.
The Nathan Hurl Award for Continuous Improvement in Nursing is presented in recognition of excellence in the pursuit of process improvement and innovation, while demonstrating the key attributes of integrity, respect, teamwork, accountability, and drive to improve. The 2025 honoree is
Megan DeFranco, Cleveland Clinic, Marymount Hospital. Megan says nursing is more than a career. It's her purpose and passion. As an assistant nurse manager in the ICU, she is dedicated to continuous improvement. Megan was instrumental in rolling out a recycling program for disposable leads, which reduced waste in the ICU. The program has been adopted at other Cleveland Clinic hospitals.
Thank you, Megan, for your commitment to improving care for patients. And congratulations on being this year's Nathan Hurl Continuous Improvement Award recipient.
The Nancy M. Albert Excellence in Nursing Research Award is presented in recognition of excellence in research and raising awareness of the value of evidence-based practices that result from nursing research, and to encourage nurses to think innovatively, develop research questions, conduct research, disseminate findings, and translate them into practice. The 2025 honoree is
Tanya Moyes, Cleveland Clinic Main Campus. Tanya has served as Clinical Nursing Director of the Digestive Disease and Surgery Institute for 3 years. She has participated in nursing research on a variety of topics, from hospital-acquired pressure injuries in patients with vascular disease to compassion fatigue in caregivers. Tanya finds research incredibly fulfilling because the projects help inform and support fellow nurses and healthcare leaders.
Congratulations, Tanya, this year's Nancy M. Albert Excellence in Nursing Research Award recipient. Thank you for your service and commitment to Cleveland Clinic.
Our next award of the evening is the Carolyn T. Neiman Advanced Practice Registered Nurse Excellence Award, presented in recognition of excellence in clinical care, support and promotion of APRN role, and interdisciplinary collaboration. The 2025 honorees are
Lauren Brewer, Cleveland Clinic Main Campus. A clinical nurse specialist in the Digestive Disease and Surgery Institute, Lauren is a staunch champion of enteral access. She was instrumental in starting Cleveland Clinic's Enteral Nutrition Clinic in 2022. She has changed the landscape of enteral nutrition access for many patients, created new policies and procedures, and provided education on a much-needed topic.
Amanda Simeone, Cleveland Clinic St. Lucie West Family Health Center. A veteran nurse of 26 years, Amanda has served as an APRN in primary care at the Family Health Center for a decade. She has a knack for identifying the root cause of a patient's issue and developing an effective treatment plan. Amanda is committed to obtaining the best possible patient outcomes, as well as mentoring the next generation of nurse practitioners.
Congratulations to Lauren and Amanda, this year's Carolyn T. Neiman APRN Excellence Award recipients. Thank you for your service and commitment to Cleveland Clinic.
Congratulations, honorees. Hearing your stories is humbling. It is evident that your extraordinary dedication and clinical practice inspires and influences our organization, the nursing profession, and the global healthcare landscape. With passion and resolve, you are making our vision to be the global leader in nursing excellence today and tomorrow a reality. Thank you for all that you do to strengthen our Cleveland Clinic family and advance care for everyone, everywhere. We will now begin our recognition of 12 incredible nurses who are receiving Lifetime Achievement Awards. This award is given to those who have demonstrated significant accomplishments in advancing nursing practice, improving patient outcomes, enhancing work environments, and promoting multidisciplinary teamwork. Recipients possess a profound level of commitment to the nursing profession, and tonight's honorees have a combined total of more than 470 years of nursing experience. Please join me in celebration of our 2025 Lifetime Achievement Award recipients.
The 2025 Lifetime Achievement Award honorees are
Sandra Bruner, 37-year nursing career, Cleveland Clinic Mercy Hospital. Sandra has spent her entire career as a surgical nurse. She is a robotic surgery champion who shares her expertise as a preceptor and mentor for nurses in the operating room at Cleveland Clinic Mercy Hospital. As a member of the Nursing Practice Council, Sandra advocates for patient safety, quality care, and efficiency. She is highly respected by surgeons, physician assistants, and clinical nurses on her team.
James Zielony, 40-year nursing career, Cleveland Clinic main campus. James joined Cleveland Clinic after graduating from nursing school. Today, he serves as a sarcoma coordinator at main campus. Through the years, he has made substantial contributions to the body of nursing knowledge through research, journal publications, and involvement in educational programs. James participates in shared governance initiatives and inspires peers to pursue excellence in their practice.
Janice Crow-Guzik, 35-year nursing career, Cleveland Clinic Hillcrest Hospital. Janice has been a nurse at Cleveland Clinic Hillcrest Hospital for years. She helped create the role of throughput nurse on a medical surgical unit, a position she has held for the past 6 years. Janice manages patient admissions and discharges to ensure smooth transitions within the unit, which allows clinical nurses to focus solely on their patients. Janice shapes the culture of the unit through dedication, teamwork, and a constant pursuit of knowledge.
Nina C. Hauger, 53-year nursing career, Coral Springs Family Health and Surgery Center. With more than 5 decades of nursing experience, Nina remains exhilarated by the profession and continued opportunities for learning. Through the years, she has worked in acute care, post-anesthesia care, and ambulatory outpatient settings. She is currently a licensed practical nurse at the Coral Springs Family Health and Surgery Center, where she strives to provide individualized, compassionate care for colorectal patients. Nina personifies the Cleveland Clinic values of empathy, teamwork, and integrity.
Denise M. Hutton, 43-year nursing career, Cleveland Clinic Fairview Hospital. Denise has been a nurse in the OR for most of her career. In 2022, she joined Cleveland Clinic Fairview Hospital's surgical team as the only nurse practitioner. She became a change agent, advocating for the expansion of breast reconstruction services and enhancing the overall scope of plastic surgery offerings. Denise has assisted with the implementation of new surgical techniques, including the first single-port robotic DIEP flap procedure for breast reconstruction. She inspires others to excel and work toward a common goal of delivering the highest quality patient care.
Fred Karbowski, 32-year nursing career, Cleveland Clinic Center for Connected Care. Fred has worked for Cleveland Clinic Home Care for the past 30 years, where he currently serves as a care coordinator. He helped develop, pilot, and implement the Care Coordination Program for home care, which increased the number of patients served while providing specialized care coordination and discharge planning for some of the highest risk patients. Fred's extensive knowledge of home care makes him a valuable resource for both field clinicians and leaders within the organization.
Diana Carius, 46-year nursing career, Cleveland Clinic main campus. Diana has made significant contributions to cancer care throughout her nursing career. She was drawn to the oncology specialty as a young PACU nurse caring for patients undergoing biopsies and surgery for cancer. Today, Diana serves as a clinical nurse specialist in hematology and oncology at Cleveland Clinic main campus, where she has taught hundreds of nurses how to meet the unique needs of cancer patients.
Irene Moody, 52-year nursing career, Cleveland Clinic, Indian River Hospital. Throughout her nursing career, Irene has remained devoted to providing quality care to patients in a variety of settings. She worked in the correctional system and established a small business that offers respite care to the community. Irene joined Cleveland Clinic, Indian River Hospital 20 years ago and now serves as a triage nurse in ambulatory care. She has keen instincts for understanding symptoms, listening to patients, and making clear recommendations for care.
Mary Abimbola Odula, 23-year nursing career, Cleveland Clinic, Abu Dhabi. Mary is a nursing veteran who has served for the past 7 years at Cleveland Clinic, Abu Dhabi as charge nurse on a cardiothoracic step-down unit. Her leadership in implementing evidence-based protocols has improved patient outcomes and reduced complications and readmissions. Mary's focus on caregiver well-being has boosted morale and retention and strengthened the sense of community within the nursing team.
Heather M. Tolino, 32-year nursing career, Cleveland Clinic Center for Connected Care. Heather has been a nurse for over 3 decades and a care coordinator with Cleveland Clinic's home care team for the past 4 years. She collaborates with a multidisciplinary team to ensure quality patient care and reduce readmissions. Heather recognizes the challenges of providing home care and follows up with caregivers to learn how she can help alleviate stress. Outside of work, she founded the nonprofit organization Adam's Angels in honor of her late son to support children and families in Ashtabula, Stark, and Lake counties.
Kelly A. Vasquez, 34-year nursing career, Cleveland Clinic, Medina Hospital. Kelly began her healthcare journey in high school as a candy striper at Euclid Hospital. Today, the nursing veteran is a clinical nurse in the endoscopy unit at Cleveland Clinic, Medina Hospital. During her 7 years on the unit, Kelly has helped improve patient satisfaction and procedure turnover times. She has served as a preceptor and member of her unit's shared governance committee. Kelly demonstrates integrity, empathy, and teamwork daily.
Teresa Westerhide Howler, 43-year nursing career, Cleveland Clinic, Akron General. Teresa recently retired after dozens of years in the nursing profession. She spent several decades as a clinical nurse in the ICU and cardiovascular surgical unit at Cleveland Clinic, Akron General, before finding her calling in nursing professional development. For 15 years, Teresa mentored and trained new nurses and technicians. She was not only an exceptional instructor, but also a trusted leader who inspired teamwork, confidence, and respect.
Congratulations to all of our Lifetime Achievement Award recipients, and thank you for your astonishing combined 470 years of service in nursing.
Nursing is a calling. To be a nurse isn't what you do, it's who you are. Some will remember a specific time or event when they knew nursing was the only path for them. Others will say there was no defining moment. The desire and need to care for people as if they are members of their own family simply drew them in. We share with you now heartfelt reflections from our Lifetime Achievement Award recipients, showcasing the power of purpose and how they fulfilled it by advocating, educating, healing, and leading throughout their professional journeys.
Why do I do this every day? I love the patients. I love the interaction with my peers. To have that combination here at the Cleveland Clinic just keeps me going.
I like the technical aspects of the surgery, to work together in that team environment with one common goal of taking care of that patient right there, right now.
My why to go into nursing was getting into homes, helping people meet their goals. Now it's helping the nurse in the field grow.
I really want to make sure that the generations coming up know how to take care of the patient properly. It's important. It all goes back to how do we give these patients the best care? That's my purpose.
When I had my first daughter in 1991, and they were premature, the nurses were treating these children with so much compassion, dignity, and respect. So I decided to be a nurse. It gives me joy that I will come and make somebody else's life a better one.
Being a breast cancer survivor, I understand how scary being in the hospital can be. That is what makes me get up every day. How can I make a change in their lives for the better?
I became a nurse when I was 19 years old. I was a young mom. Adam's Angels was an organization I started after I lost my son in 2019. It's a nonprofit that it aligns with the nursing career. It's about giving back. Helping people is just a calling, something that makes me feel complete.
My purpose is trying to always improve, always be better, always do the best I can.
I discovered I wanted to be a nurse when I was 12. After I did a report on nursing, I still continue to love to help people, and I love what I do.
Even though we all have a different journey, we work as a team, taking care of patients and our families.
It might be a tough day, but at the end of the day, you know you made a difference. That's all. That's it. I mean, it's a great feeling. It really is.
That's why I'm still doing this. It's in here. You know, I'm supposed to be here.
What a wonderful reminder that every day is an opportunity to apply the power of purpose. By staying true to what energizes us, we can all give an outstanding experience to our patients and each other. As we bring our celebration to a close, I'd like to again offer my sincerest congratulations to each of our 2025 award recipients. I'd also like to express my gratitude to our planning committee, production team, and Drs. Tommy Holovich and Kelly Hancock. To the friends, families, and colleagues watching, thank you for supporting the nurse in your life. We're glad you could join us.
This has been the 2025 Maria and Sam Miller Nursing Excellence Award Ceremony. Thank you for watching, and congratulations to all of tonight's remarkable honorees.